I'm Attorney Ramsey Bahrawy, and this is Your Money, Your Life. Are you becoming more forgetful? Do you have trouble recalling names or maintaining your train of thought? Do you refer to those events as a senior moment? Today our topic is the distinction between cognitive decline due to natural aging and Alzheimer's disease. Assisting me in this discussion is Marilyn Stasonis, registered nurse who for the past 30 years has served as an Alzheimer's specialist. In addition, she was instrumental in developing the first Alzheimer's Day program in Massachusetts. Thereafter, she worked with the Robert Wood Johnson Foundation in the development of Alzheimer's Day programs in the United States. And that's not all. Marilyn demonstrated her commitment to the care and treatment of people living with Alzheimer's disease by her membership in the Massachusetts Assisted Living Association, where she was involved in regulation review and policy development. Additionally, she's been a frequent invited speaker in many arenas on Alzheimer's disease and related dementias. Currently, Marilyn is the Director of Wellness and Memory Programs with the Northbridge Companies, a company providing the next generation of senior living. Marilyn, it's great to have you on the program.
Thank you. Thank you for having me.
Okay, so as I said in my open, today we're going to talk about the difference between normal age-related cognitive changes and something more serious, Alzheimer's disease. But before we get into that, could you talk about what is normal age-related cognitive change? What is that?
Well, I will tell you, Ramsey, even over the age of 20, our brains start to deteriorate a little bit, and there start to be changes. We're really at the height of our cognitive abilities in our 20s, and then it continues to change.
That early in our 20s?
In our 20s,
wow.
we've reached the peak
so
in our 20s.
It's all downhill
It's
after
all
that?
downhill from there.
Okay.
But it's not so much downhill. We may lose the speed, but we gain more wisdom, is really what happens. When we think about having memory loss or having changes, we all start to worry and get concerned about it. And think when we can't remember names, or we lose our keys, or we can't remember where we parked our car in the parking lot.
I'm guilty of that one.
I'm guilty of all three, actually.
Okay.
So we all get concerned that it's something greater. There are changes, and as you hit your 60s, 70s, and into your 80s, you do decrease the ability to think as quickly, to do things as quickly, to recall things as quickly. But I will tell you that even though it may take a little longer period of time, the reality is that if you were to have someone do a test who was in the younger 20s and 30s and someone in their 80s, it may take them longer, but they could score just as well. Okay. Normal aging, we should not lose our ability to think clearly and to recall. It just takes a longer period of time, and yes, we do have those moments where, this afternoon I'll remember your name, and when I go home I'll probably be like, now his first name was what? And it's pretty normal.
It's pretty normal. Okay, so people, you see this all the time at social functions or in coffee shops where people will be talking along, and all of a sudden they've run into a roadblock of some sort. They can't remember part of a story they want to tell, or they can't remember a name or some word that's on the tip of their tongue. They just can't pull that word out.
Yep.
And you're saying that's really pretty normal?
That is pretty normal. When you talked about that word that they couldn't find, they may substitute another word for it that would take its place that's appropriate.
Right.
So that would be pretty normal. If they were to substitute a word that really didn't belong in the context, that would not be.
Let me ask a related question to that. And let's say we have somebody who grew up with a foreign language, not English, who grew up in a foreign country until they were in their mid to late teens, let's say, and they immigrated to the United States, and now this person is an older adult. And when they run into that roadblock where they can't grab that English word, they grab the word of their native tongue.
You bet.
Is that normal?
A lot of time, that's very normal.
That's normal.
It's very easy for them because it goes back into long-term memory, and they'll retain that. Absolutely. That was a comfort zone, and that was something that they had.
And is it that perhaps because that's something they learned when they were a lot younger, that they have a better memory for that?
Because they're tracking the older memories rather than the recent.
Now people that have age-related cognitive decline, they can live independently and they can do that safely, right?
Absolutely.
Yeah. Okay.
Yes. There's such a thing as what we call mild cognitive impairment. And mild cognitive impairment, which was something that they weren't diagnosing, I'm going to say 15 to 20 years ago, people recognize that they have a little bit more than just those lapses of memory. They have a little more concerns. It doesn't impact their daily activities. It doesn't impact their ability to take care of themselves. No, not at all. So you can have some mild cognitive impairment and still stay in your own home and still be able to take care of yourself, even live totally independently.
But let me make sure I'm understanding here correctly. So, so normal age-related cognitive decline and mild cognitive impairment, are they the same?
They're really not the same.
They're not the same.
No.
Okay, tell us what the difference is.
No, there isn't the same. Normal aging, you know, you're slower in your response time, slower in bringing back the memories. Mild cognitive impairment means that your cognition is truly impaired. There is some memories you cannot bring back. The interesting piece with mild cognitive impairment is that a percentage of those people will go on to developing Alzheimer's disease. A percentage of those will stay the same, and a percentage of people will go back to having normal cognitive thinking. But you know, there's still so much to learn about mild cognitive impairment. It's just that slight decline below your normal aging that changes.
Okay, so you've got age-related cognitive changes, and then the next step up, so to speak, is then mild cognitive impairment.
Correct.
Okay. It's good to know. Now, a person with mild cognitive impairment, is that person at more risk for developing dementia or not?
They're more risk for developing Alzheimer's disease.
And why is that?
Most of the research has tried to focus now on looking at people earlier on or before there's any cognitive impairment, or looking at it really early, because that's where the research wants to try to head to prevent Alzheimer's disease, or to prevent more cognitive impairments.
We hear oftentimes in social discourse where people who can't remember something oftentimes can't remember a name, and they'll say, you know, I'm having a senior moment. Is there such a thing as a senior moment, or is that just a figment of people's imagination?
There is such a thing in some ways of a senior moment. It's kind of a comical term that we use.
Yeah,
you know, that everybody uses.
It is.
You know, I think it is a comical term because I think everybody gets concerned. We all get concerned about the fact, particularly as we get older, if we can't remember something. The important piece here is not so much that you can't remember the name, but that you would know and be able to process and determine how to find that name.
Right.
So that if it was, you know, or as you probably has happened to you, you may not remember a name, and then you leave the setting, you get in your car, you drive home, and all of a sudden the name comes to you. That's not a concern. It happens to me.
Yeah.
You know, or I may be talking, my husband and I may be talking about an old movie and see a movie star. Neither one of us can remember the name, and if we don't have our iPhones with us so that we can look it up, we'll later on say, oh, I remember who that is. It comes back. Wow. So those senior moments they really do happen. The important piece is that you're able to retrieve the information maybe later, or you remember that you forgot something.
Right. Well, you know, the most frustrating experience, to be honest with you, that I had, and I just had it recently, is I was in a coffee shop, and I was talking with someone, and we had both seen the same documentary on television. We both knew what the documentary was about, but we couldn't remember the name of the very famous author that it was about. I see this person this morning, and he says, I remembered the name. It was Gore Vidal. I was like, that's right. But it was so frustrating. Neither one of us could remember the name.
Yeah. And
he was very famous.
I know, but the more frustrated you get, the more stressed you get, the more frustrated you get, the less likely you are to remember.
Well, that's true. You then get stressed and you're not going to remember.
Then you get stressed and you're not going to remember.
You're not going to remember.
Yeah,
You're absolutely
that's
right. Is it fair to say then, after the normal aging of the brain, and then you have mild cognitive impairment, would early onset Alzheimer's be the next step, or is there something in between?
No, there isn't anything in between.
Okay.
There are other dementias, such as vascular dementia, frontal temporal lobe dementia, Lewy body dementia, but the majority, about 65% of dementias, is caused from Alzheimer's disease. And you know, the differences that you see is that initially people who had the mild cognitive impairment, who could function nicely in their home, are now having difficulty completing other things. Let's say that they
Let's have some examples. Let's see what
Sure.
you're talking about.
Before they were able to, like maybe it was someone who was a very good cook and always did a great job with recipes. Is now when they're making things, you're tasting them and you're realizing there's something either missing or too much of in the recipe. That's a significant change for someone.
Okay.
If someone was an accountant who had always worked with numbers and now was missing paying bills, or was double paying, or was having difficulty doing figures, that would be a significant event. For me, it wouldn't be significant because I just do my checkbook whenever I feel like it.
Oh, you do?
That you really. So that for me, it wouldn't be significant. But for me, it might be. I mean, I like to have everything in order in my home, and if my home started to look disheveled, things change.
Right.
It really depends upon the person, where the family would turn around and say, you know, this isn't quite the person.
Right.
They're not being the same person that I knew. They're also not remembering things that they should remember, maybe significant birthdays, maybe they, excuse me, maybe they needed to go out to a certain event, which was a big event, and they were like, oh no, I wasn't invited, but they were. There's usually a significant thing that occurs that makes people stand up and listen.
Right.
Because what happens as people's memory changes and it becomes a little worse, they'll try to cover up. You know, people feel like they're losing their mind. They just feel that, you know, I should be able to control this. So they work harder at it. They write more notes, but then they lose the notes.
Right.
Or they write things down and then they can't find which one goes with what day. So we're talking significant changes that would make you say, oh, I think there's something wrong here.
Let me present you with a scenario. What if you have someone who always put their keys in one particular place? You know, let's say the hook by the door, right? Always put their keys there. And on one particular day, this person walks in the house, can be a he or a she, doesn't matter, goes to the refrigerator and puts the keys in the freezer.
You might be concerned. Yes,
Yeah.
they don't belong there.
Yeah, well, no, keys don't belong in the
They
freezer,
don't.
but
If they,
is that somebody who's absent-minded, or is that somebody who's maybe
well, see,
suffering from an illness?
The thing is, it can be absent-mindedness.
Yeah.
You know, I put my keys in the same place all the time, but there are times when we will, you know, you'll walk in the house and maybe you have bundles or whatever, so you take the keys with you. So then you may go back to your usual place and you'll say, my keys aren't here.
Right.
The important piece here, though, is that what do you do to find your keys? You retrace your steps.
Yes, exactly. Retrace your
Is that
steps.
you think about, okay, what room was I in? You know, where did I put things down? What did I have in my hands? Why didn't I? The person who has a memory loss that is really starting to live in the moment, they're not able to do that. They're not able to then retrace their steps. They're going to walk everywhere, not knowing where to go and think, where are my keys, where are my keys? And sometimes they get the keys and they'll say, well, why was I looking for them and what do I do with them?
Can someone who's in the early stages of dementia or even further along, can they engage in abstract thinking? Can they do that?
No. They frequently, you will see that they're unable to discuss any current events. They're not able to retain that information at all. They may sit with the newspaper and then you'll ask them what they read and they'll be very generic and say things like, oh, there's nothing new. It's all the same thing all the time. You know, well, and you'll ask them, did you read that article about the airplane crash? No, I didn't. I didn't get to it yet. They become very, very vague because they know they're losing their memory early on. So they do try to cover it up. So there's a lot of those things happening, and it really does put up red flags to families that, you know, this is not the person, because you see the personality changes along with the memory. Because if this is something that's not consistent or the same of what the personality was, then you're going to sit there and say, you know, there's something going on here.
What kind of personality changes does one see in somebody who's living with Alzheimer's?
More irritability initially, more irritable, somewhat more paranoid. You never told me that. Where did you put my things? Those types of things. Blaming other people. If you know somebody says to you, you know, well, you were the one who had the appointment book. No, I didn't. I gave it to you. And then a little more argumentative. And some of that argumentativeness and is real fear. They really do believe that they don't have it, and if they did, then they're really concerned because they have lost their memory.
Okay, all right. So you see personality changes.
Yes. Change in your intellect, thinking. They're not thinking the same way, like what I talked about the checkbook. They're able to think logically. They also may have difficulty with communication. It goes beyond just word finding. They may insert inappropriate words, or they may have difficulty even completing sentences correctly, and then they dismiss you. They may have perceptual issues. You know, when we walk into a room, you know where to sit in the middle of a chair.
Right.
Perception is our ability to
Right.
determine where that framework is. They have difficulty with that.
Okay.
You know, and not everyone has all of these changes all at once, and the disease is individual depending on how it progresses with people, but memory is the hallmark.
Let me provide you with another scenario, and this is something that actually occurred with a client of mine. Was driving a vehicle and ended up hitting another vehicle, and said he hit the vehicle because he didn't think the vehicle was where it was.
Yep,
It was a judgment issue.
Again, a judgment and perceptual issue.
Right,
Absolutely.
okay. That's a little more dangerous because he's driving a car.
Much more dangerous.
Yeah.
The driving piece is a real concern and a real issue. You know, to begin with, it's a lifeline for most people.
Right.
And it's a right. We all drive.
Right.
And have been driving for many, many years. The thing is that, you know, a lot of times it would really need to be the physician who basically says to you, you should stop driving, and they may or may not listen. It can go to the registry. Those are concerns.
Yeah, sure they are.
The driving piece is truly a concern.
I agree, yeah.
And when you have someone like this person you were talking about, you're probably going to see more nicks and dings on that car than you ever saw, you know, since you've seen some memory loss.
If a person has not been diagnosed with dementia, and maybe has some, you know, age-related memory loss, but other than that is okay, is there anything that person can do in order to strengthen their memory, so to speak? Is there anything that can be done?
Well, you know, the words use it or lose it is very true.
Use it or lose it.
It is, use it or lose it. The other thing that is very true, and we talk a lot about now, is that when, you know, there's been so much discussion about what we need to do for our heart, for heart health, between exercise and diet and eating the correct foods and everything. The reality is, and when I go and talk to a lot of elders, they'll say to me, what can I do? And I'll say, well, the same thing you do for your heart, you need to do for your brain.
Right.
There's no difference.
Right.
And your brain is a bigger organ, but it too needs the same things. The exercise helps, socialization, getting you sleep, minimizing your stress, eating the correct foods, you know, the omega-3s, having your salmon, your vegetables, all of those things. But the belief is that, you know, that needs to start even before our age, to tell you the truth.
Right.
But, you know,
It needs to be a lifelong habit, you're saying.
It really does.
Yeah.
But elders can still control and keep their brain active by doing all of these things.
Yeah.
They really can.
Okay. How vigorous should the exercise be? You said exercise.
Yeah, it can be whatever people tolerate. There's been a lot of studies with exercise at the Hebrew Rehab in Roslindale, and that even a minimum amount of exercise, unlike what maybe you or I could do or some younger people would do, you know, 10, 15 minutes of exercise, just walking or just using little small weights, anything, small amounts of exercise has a tremendous impact on the muscles as well as your well-being.
Decades ago, as part of our work, we got exercise, but today we're such a sedentary society. We sit in front of computers, we sit behind desks, so we need to find our exercise in other places.
Yeah, we sure do.
And, you know, I agree with you. It's important to exercise for your mental as well as your physical health, for both of them.
Yeah.
And then, so you say exercise, you say diet, you said socialization.
Yes.
What kind of socialization?
Whatever you want. Whether it's you want to go to bingo or you just want to go down and have coffee with a couple of your friends. The isolation of elders, which does happen with many of them.
Absolutely.
Isolation of elders and not having that contact and that stimulation. Or even if you don't want to be social in a large group, to be at the group involved and watching is stimulation. So it really doesn't have to be anything in particular.
Okay. Is it good for an older adult to go to the local senior center and participate in their activities?
Absolutely.
Yeah.
Absolutely.
Because that's obviously
That's
socialization.
huge socialization.
Yeah.
Absolutely. It works. It's a wonderful thing to do.
And you don't only have the socialization, but then you develop friendships and you get support.
You do.
And there's a lot of that going on there. Yeah.
Absolutely.
Yeah. Okay, so that's something for the older adults to keep in mind.
You bet.
Go to your local senior center.
Yes,
Yeah.
absolutely.
Okay.
Get out if you can.
Yeah.
Yes. Do something.
All right.
Yes.
All right. How about something like meditation? Is that important for your brain health?
Of course. Meditation is great. It's also a stress reliever, which is very important for people to do, to just relieve their stress. And meditation, whether it's meditation, yoga, or whatever, it's one of the components of heart health as well as brain health.
Okay.
Yeah, absolutely.
Now, if a son or daughter goes to visit elderly mother or father,
Yes.
and they are noticing significant, not minor, significant brain changes, memory changes, memory changes, what should they be doing? You know, how do they approach this issue?
You know, it's difficult when children come, and particularly if they're long distance, it's really difficult for them to come and see this. And a lot of times, you know, families will think this is something, that they'll poo-poo it, so to speak, and basically say, she's not getting out or whatever. And they'll also think, and I've heard it many times from families, if mom tries hard enough, she can remember. Okay, but if they see those significant changes, if they walk into their mother's apartment and they see that, she might have the same clothes on, she hasn't gone to the hairdresser in a while, they open the refrigerator and they see that the food's not fresh, that it might have been expired, that it doesn't look like she's been out, and there's no laundry, you're unclear. And we're talking significant changes because there's a lot of things in the household. Or even if the bills haven't been paid, or been paid twice, or the checkbook's a mess. The first thing they really, really need to do is they need to make an appointment with the doctor. They have to. The thing with dementia, which is just a group of symptoms, is you need to determine what's causing it. And it may be that it's Alzheimer's disease, but it also may be that it's something that you could treat and that they could fix. Maybe if you took mom to the doctor and she had a total physical, which she really needs to have, and don't ask her if she wants to go, just make the appointment and take her, because more than likely she's going to say no.
I was just going to say, what do you do if mom and dad says, no, I'm not going, and they resist?
You basically
what do you
say,
do at
look,
that point?
I got to go, I'm going to the doctor, can you come with me? That's what I always say.
Okay.
Use that.
All right.
I need to go to the doctor, would you mind coming with me? And just kind of walking them in.
All right.
The thing is that what's so important is to make sure that there's a physical exam, to make sure it's nothing that could be treated. If you had an elder who had dementia and was exhibiting those symptoms and it was caused by a brain tumor or fluid on the brain or an uncontrolled thyroid problem or a vitamin B12 deficiency, all of these things can cause those changes. You could fix those things.
There are also other conditions that mimic Alzheimer's,
Absolutely.
right?
There can be.
Severe depression, alcoholism,
Absolutely.
drug abuse,
Yes,
right?
absolutely.
So it's another reason to go out and be seen by a doctor. It's another reason for the person to resist, though, right?
Well, yeah, but, there has to be more than one way to skin a cat, and I think that you have to, in many ways, you have to be creative. And I know families do it out of love, and really you want to make the person better, so that you have to find a way to do it. They really need to take them and make sure that it's not something that you could fix, and make sure it's not something treatable, because that always concerns me. I always get concerned that an elder may be diagnosed as, she's 80 and she has a dementia. Well, maybe it's a urinary tract infection. Maybe it is any of the things that you brought up or I brought up or a myriad of other things.
Right.
And so if you were to treat those and take care of those, that person's confusion may never go back to total normal, but would clear enough to be able to let them function better. It would be really sad if somebody's not diagnosed correctly.
Can you talk a little bit about the importance of somebody who does have a dementia, who's no longer living safe at home, going into something like assisted living?
It's a great arena, it's a great environment for people because, first of all, it provides the socialization, which we've talked about. It provides the meals, but they still have their own little apartment. and some of them aren't so little, where they can bring all of their things, staying in and have housekeeping come. Plus they can have the personal care. Plus they can have the reminders. You know, the staff will come knock on the door. It's time to come to breakfast. The assistants, if they need it, with bathing and dressing. Assistants to come down and then be involved in activities. What we're doing in assisted living is we're putting in place the routine and structure that they can no longer put in place for themselves.
Sure.
We're keeping them healthy with our meals and with our observations and with our exercise and all of those components of being able to live that they can no longer do for themselves. But you want people to still be able to function and feel like they have purpose and dignity.
Sure.
And so that's what we provide for them.
Great place for us to stop.
Okay.
Just like the rest of our bodies, as we age, our brains change. Although we all notice some occasional age-related slowed thinking and memory loss, serious memory loss, confusion, language difficulties, and other major changes are not a normal part of aging. Today we learned that normal age-related cognitive changes do not necessarily interfere with a person's ability to safely live independently. Marilyn explained that older adults with mild cognitive impairment do not automatically meet the criteria for dementia. As regards Alzheimer's disease, it is not a normal result of aging. Rather, it is a disease that gradually and painfully destroys a person's memory, ability to learn, and carry out daily activities. But there is good news. Marilyn suggested steps to build a stronger memory. For example, implementing a brain-healthy diet, walking and learning something new. And don't forget the importance of accurate Alzheimer's testing, as it can rule out Alzheimer's disease and thereby identify and treat another condition that presents with similar symptoms to Alzheimer's disease. Therefore, it's critical to become more aware of the differences between mild cognitive impairment and Alzheimer's disease. By recognizing the critical distinguishing characteristics between normal age-related cognitive changes and dementia, you will better understand when additional help or evaluation is required. When the time comes for help, turn to a competent and compassionate physician who understands the effective treatments available to provide the best medical care. Also consider an assisted living community such as Stonebridge, Burlington for the right care at the right time. In closing, thanks to my guest, Marilyn. Thank you for being on the program.
You're very welcome. It's my pleasure.
And as always, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, Building Your Trust.